So just so you guys, give you guys a little bit of background. So the video you guys watched yesterday, we filmed that's on our pediatric unit in the hospital. And we made it a point to film it from, I actually filmed it from basically the level at which a kid would be at. So you guys can really feel like that's what it would be like when you were walking in the pediatric floor. That is as realistic as the experience gets. Those were two of our pediatric nurses that were working on our patients. That's exactly the experience that you would have if you were really sick, because that was a situation that we were showing off that when you're really sick, what happens is it's really important to get things done quickly, right? So there are a few things that need to be done immediately because our main concern is that you as a patient are safe. So things like what your heart rate is, what your breathing rate is, how much pain are you in. Those are things that we need to find out as quickly as possible. And a lot of times in that process, a lot of the things that we could say that would make the experience more positive or less scary for the kid get kind of almost, not pushed to the side, but kind of pushed to the secondary level, because the main concern at that point when somebody's really sick is making sure they're okay. But you can't avoid the fact that that can be a scary process. So to give you a little more in depth about what our two pediatric specialists here do, Laura, as a child life specialist, her job is to educate children, patients, family members about what the experience is going to be like in the hospital and to create a more pleasant experience for them in the hospital. So she is trained, and her main focus is basically to do kind of what you guys are doing. How to make that experience less scary for everybody involved. So she's an excellent resource for you guys as far as the techniques and the things that are done essentially in order to make what can be a very scary experience hopefully a little more positive for everybody involved. And then Krista, our charge nurse, she is in charge of the operations of the entire pediatric department. So that involves everything from who's working that day, who's taking care of who, what kinds of patients are there, what kind of resources those patients need. So she really is the kind of go-to knowledge base for everything about how a pediatric hospital unit works. So, so when you guys are brainstorming questions, you kind of think about where they're coming from, because they have an enormous wealth of knowledge that they can provide for you guys. And go.
Do most of your kids at the hospital stay overnight?
That's a good question. So it ranges, but anyone who comes to our floor, so there's the emergency department where kids come in and out, but they're admitted to the unit, then usually they do stay overnight.
How long would an overnight stay typically be? How many nights?
Could be one night, it could be a few weeks. We don't take care of
Write things down, people.
any of the real long-term stuff that would require staying longer than a few weeks.
Next question.
Do you think it's possible to make the wires and the monitors in the room less visible? Because when I went to a hospital when I was little, because I had surgery, what really intimidated me in the room was all these monitors, checking my heartbeat, my blood pressure, all that, and I was scared because I thought something bad might happen.
That's a great idea. We definitely would need them to still be loud enough for the nurses and doctors to hear if they started harming anything. But as far as visibility,
Concealing the wires.
yeah.
There is some technology right now that they use in the cardiac units that are like telepacks, so the wires are only connected to a little box, and those boxes transmit to a central monitoring station. So although there's wires, they're under their shirts and they just connect to a little box that transmits somewhere else. So they're not connected directly to a monitor at their bed. We do not have that right now on our unit.
But we think you could redesign that experience. Those wires are scary, but is there a way to communicate with kids in the hospital that what these wires mean and how to maybe explain to the kids what do they do and make them less scary? So I think there's a lot of ways that we were thinking of brainstorming about how to do that, but I think you guys could come up with some better solutions than us.
Because you were probably scared because you didn't know what the wires were, what they were for, what they were going to do. So, a lot of times just explaining to the kids what they are, letting them feel them before you put them on the child's body, that helps a sometimes we don't have time to do that, which is an interesting time frame in the emergency department, which is something to also consider. Yeah.
What's typically your busiest time of the year for the emergency?
Back to school time, around September through December.
Why do you think that is? Why do you think that is?
Germs.
Really?
Everybody goes back to school and expose each other to lots of new things, and it's also change of season, so children with respiratory problems tend to get affected from that change in the weather. We see a little bit of an increase now at spring when allergies start acting up, but then it really, that's prime virus season.
What other questions you got, folks?
I have another question. When patients have to stay long term, do you have any way of entertainment for them? For example, like a TV in the room or some way so then they can stay entertained? Or
Yeah. So that's a big part of our children who are staying longer is provide them with activities and provide that sense of normalcy again. So we have iPads on the unit, we have video games, we have a team room with like an Xbox, a PlayStation, board games. We have a playroom for the younger kids with, dolls and cars. Whenever possible, we want to bring them out of the room as much as we can. Sometimes children are on isolation precautions. So
What does that mean?
So that means that you can't leave your room. So whether it's for the safety of other patients, if you have something going on with your body that could infect other children, or if your immune system's down and we need to protect you from potential infections, then we'll have to keep patients in their rooms. So in that case, we bring video games in their rooms, we bring, we get them hooked up on the internet, things to help make it a little bit easier for them to be stuck
I have a
inside.
question. Can they bring their own devices, like a laptop or an iPad, get on the Wi-Fi?
They can.
They can, and our TVs are interactive. We have something called Get Well Town. It was designed for children. They have it at some other children's hospitals. They can connect to the internet on their television. There's a keyboard that goes on, a wireless keyboard that we bring into each room, so that they can go on the internet, they can watch on-demand movies, and they can watch health videos as well.
We haven't heard that. Go ahead, go. Nice and loud. Patricia, favorite part about being a pediatrician, doing your work? All of you get the answer.
Well, I'm not a pediatrician. I'm a emergency room doctor, but I see a lot of patients who are your age and younger. I like the variety of seeing a lot of different types of patients, from a newborn to someone who's like 9 years old. I like treating the whole spectrum of people, from little kids to older adults.
My favorite part about my job is, like I said to you guys, I'm kind of like a teacher for the kids in the hospital. So these guys are focused on the physical aspects. I come in, I'm focused more on the psychological aspects. So, making the children a little bit more comfortable, making it easier for them when they're going through these difficult procedures, and getting to also help the staff by helping to calm the kids. So, like being part of the team and making the experience a little less traumatic for kids.
And for me, they come in, they're sick. They don't feel well, they're scared, they don't know what's going to happen to them. We help them to feel better. They leave with smiles on their faces, they're happy, they're saying thank you, they draw us cards and leave us pictures. They love the fact that we help them feel better, and it's very, very rewarding.
Do you have any decorations in the hallways of the rooms or anything like that?
So that's a great question. So we would love to have more. There are a lot of rules in the hospital. So I think you guys saw in the video, our walls are pretty plain. We've tried to get them painted children-friendlier colors, but unfortunately there's some hospital rules where we can't do that many things currently to make the hospitals a little bit more vibrant and child-friendly.
Right, so one of the design words that you guys need to know is constraint. Okay, so a constraint is that they can't paint the walls any way they want, and they probably can't put up posters and stickers and other things because of the germs that could potentially be there. So that's a constraint will limit what they're able to do to accomplish that.
So one thing, we do have one pediatric piece of artwork in each room. We had rooms that we trialed, sort of like fatheads, you know, those stickers that go on the wall. Part of the problem with that is a lot of times they're very gender specific. So like we had one room that was all butterflies and boys didn't like going in that room. We had, and then we take from 2 days of age all the way up to 18 years. So if we have Mickey Mouse on the wall and we get an 18-year-old or 17-year-old into that room, it's not going to work. So it's very hard to make it neutral enough so that it fits all of our age groups and both sexes. One thing that we did do was we took our light covers and we had ones ordered that have clouds on them, so that when they're looking up, they look like they're more looking up at the sky. So that's one thing that we did do there to make that a little more friendly.
Going back to the games, you ensure that they're sanitary enough?
Yeah, that's a good question. So basically we have wipes that we wipe down all the iPads with. We get specific cases for them so we can wipe down the cases without affecting the iPad or damaging the device. Yeah.
When kids stay overnight and their parents say have other kids that they have to take care of, would they usually stay with their kid that's in the hospital, or would they go home and take care of their other kid?
That's a good question.
Some do, some don't, and we understand that they can't always, especially there are some families that don't have two parents. So they may not be able to stay with the one child if there's other children at home. So we do the best we can to make that child comfortable. We have the mom, kind of talk with the child before they leave. They can call, they can talk to the patient at any time, they can talk to us to check on their child. But we see both. We see parents that stay and we see parents that go.
Could you repeat the question too so everybody can hear it for the tape?
She was asking if there's any way to play sounds in the rooms. On the Get Well network that Krista was talking a little bit about on the TV, we do have relaxing music and lullabies that the kids can have access to.
So anything that you can pull up on Google and play, we can play through the television.
Yeah, anything on YouTube, they can get like that.
So, say someone was in a room with like two patients in the same room. Is there something that can separate the two rooms, soundproof?
Currently not really. I mean, we have a curtain when there's two patients in a room, but we don't have any kind of sound barrier.
But we try not to, if at all possible. We try not to put two patients in the same room. And when we do, they are usually close in age, same sex, or sometimes if siblings come in together, we will put them in the same room.
Do you think it's possible to make the smell in the room less clean, something calming, like the smell of a beach or going to a field, kind of like a bakery, something like that?
I'm going to say probably not, because there's a lot of restrictions on that as well. Because of the amount of kids that we see with respiratory problems, we have to limit that type of thing in there, because scents can trigger perfumes. Things like that can trigger asthma attacks in children with asthma. We do not allow baby powder in the hospital for that same reason, because the children can breathe it in and it can cause problems with their respiratory systems.
What else besides needles and wires do children seem to be really afraid of?
Well, I think the thing is,
What was it?
besides needles and wires, what else are kids afraid of? It really depends on the child. So things like a tourniquet, which is basically just like a blue band that ties around, or has anyone ever had their blood pressure taken? Mm-hmm. Right, so the cuff goes around your arm, it squeezes your arm. It's not scary once you know what it is, but imagine, you're playing outside, something happens, and before you know, you're getting taken to the emergency room. So things like stickers or blood pressure cuff or a thermometer. For younger kids, they don't know what that is. So it's really just making sure they understand what it is, because if you're not familiar with it, then anything can be scary.
And it really depends on the age of the child. So their level of being able to understand this is going to hurt you or this is not going to hurt you plays a big part into what they find scary.
And I brought, and I'll hand this out to all you guys when we're done, I brought some common fears by different age groups, because exactly what Krista's saying, different ages have different fears. for example, preschoolers a lot of times think that the hospitalization is a form of punishment. So they think they did something wrong because they can't fully grasp why they're there. So it's things like that that we take into consideration with each age group and how we explain things to them, what that age group is usually focused on, what their concerns are to help try to make it easier for them. Yeah.
Would you keep like the babies in if they're like young, like just keep them in like a crib, like certain kind of crib or?
We have all different, so we have different sizes. We have a little crib, it's about this big, we call that a cribette, and the sides are only about that high, and we use that for babies up to about 3 months of age. Then we have a regular size crib that you would see in your home, and I'm gonna tell you another thing about that, that's scary, is our cribs are metal. So parents often refer to that as baby jail. And those are about the size of a regular crib, you know, the sides are about this high. Then for our toddler age group, we have something called bubble cribs. So in addition to the sides of that, there's plastic barriers all around the top so that the children can't climb out of the crib. Then we have youth beds, which similar to an adult bed, you know, you can put the head up and down and everything, but the side rails are all one piece. And then we have regular hospital beds, which have, it's actually 4 separate side rails so that we can help the patient from falling out of bed. So yes, depending on their age, they go in a variety of different beds. You had a question?
Have you guys thought of a way to make needles like less scary?
I haven't, but if you can come up with something that's going to help me with that, I would love it.
One thing that child life specialists do in facilities where kids are there a little long time is we'll actually do what's called needle play with them. So they have an alpha and they have the chance to give a needle. Sometimes it helps so that they get that sense of control and they can learn more about it. Things like an IV, which is very common for kids to get. Has anyone ever had an IV? Okay, so do you know, can you explain what it is?
So it's basically a saline solution that they put into your veins to kind of help you from getting sick or to even replace some blood that you've lost.
Yeah.
And it just makes you get better.
So, great. So what a lot of people don't know is that when kids get an IV, they use a needle. So basically an IV is a small, tiny, soft little straw that gently rests in one of your veins. So we have to use a needle because our skin's so strong, but then once that soft straw is in, the needle gets taken out and gets thrown away. So a lot of times kids are really stiff and uncomfortable because they think there's still a needle in there, so if they move around, it's gonna hurt. So what I try to do is before they get the IV is I show them the soft part and I explain to them that you are gonna feel a pinch and that there is gonna be a poke, but it's only gonna be for a second because then once the doctors and nurses find the best spot for that soft straw to gently rest, the needle gets thrown away. So again, kind of making it a little less scary by explaining to them what it actually is and how long that needle is going to be in their body.
And that
Even
also,
the adult patients think that. I have to explain that to them, that there's not a needle in there.
that also varies from age group to age group because some kids, if you explain it to them, or actually even personality, some kids, if you take the time to explain it to them, it will help calm them down, and some kids are just going to be super anxious until it happens now that they know it's coming. So that will also vary on age as well as just personality.
I know we mentioned like restrictions and stuff like that before, and feeding off of the whole parent's anxiety. Is there anything like, what restrictions are there on the baby jail? Because I can imagine like that little metal thing in the bubble. So what restrictions are there?
Restrictions, what do you mean?
Like, can we change like it to not look like a baby jail?
I mean, at the end of the day, the safety is the priority. So the parents call it baby jail, but basically what it is so that the kids can't fall out of the crib. Because if you have a toddler who's able to pull and crawl or walk, we have to make sure they're safe. So that's why it's railings and then a bubble so that they can't come out.
And we have to be able to clean it with industrial cleaner. So like wood or laminate won't really hold up as well. It has to be able to, like,
It might get blood on it. It might get thrown up on. It might get peed on. All these bodily fluids could get on that surface, and we need to be able to clean it. So, sorry. That includes your temperature, your heart rate, your respiratory rate, your blood pressure, and sometimes your oxygen level, okay? So we need tools to be able to do that. This, has everyone seen one of these? Yeah. Do you know what it's called?
Stethoscope.
Great. Okay, so this, we can put this in our ears. It allows us to listen to your heart and your lung sounds, okay? So that would be first line of assessment, okay? A thermometer I did not bring, however, I'm pretty sure every one of you have seen it. We can check that many different ways depending on the age. We would, in a baby, we would check it either under their arm or in their butt, okay? In an older child, either under their arm or in their mouth. There are all different kinds now that you can scan the forehead, you can do the ear, there's all different disposable ones and things like that, but they all come to the same conclusion, and that is how hot is your body. Okay, this is a blood pressure cuff. So a blood pressure cuff goes around your limb, usually your arm, okay? It wraps around, and then once it connects to the machine, it pumps up and gets real tight. So a lot of times with the little kids, when they come in, if they've never seen this before, I explain to them that it's gonna give their arm a hug, okay? It squeezes kind of tight, but if they stay still, it's going to go down really quickly, and we're going to take it right back off. So I try to explain that to them to make them comfortable. It doesn't hurt, it just squeezes. And as soon as it's done squeezing, we get to take it back off of them. So you can pass that around. And then this is leads. So this is if you're going to get put on a monitor, okay? You would have, this is the adult size, that's the baby size. You can open that up. You would get 3 of these put on, one on your right chest, one on your left chest, and one on your abdomen. And that can allow us to watch your heart rate and respiratory rate when you're in a bed. So like continuously, instead of going and listening with our stethoscope, if we need to keep an eye on your heart rate and respiratory rate, this will allow us to do that. And then I talked earlier about your oxygen level. So this is a cool piece of equipment, and this is not something you can do without a tool. This is something you need a tool to be able to measure. It does make a lot of beeping noises. This will also give us your pulse rate, which means the rate your blood is flowing through your veins instead of coming out at your heart. So sometimes they can differ a little bit, but they should be pretty close. Would someone like to be my...
I'm good at
She's got her finger out.
We'll do you. Okay? All right. So, it doesn't hurt, right? No, it's just a red light. It's gonna bounce light through one side of your finger to the other side of your finger, which is gonna allow us to pick up your pulse rate as well as your oxygen level. Okay? So, down here, this green number, 83, that's your heart rate right now. Okay? That's good. That's fine. Are you a little nervous? Because it's a little high, but it's fine. I'm only kidding. And this number right here, 100%, it's the best you can get. Okay? So that's your oxygen level. So we like that number in children to stay about 92 or higher. Okay? When it goes lower than that, we know they're having some trouble oxygenating their blood, and if they can't oxygenate their blood, they can't get oxygen to their organs and their brain, which can cause a lot of problems. Would someone else like to try? So when it comes off, it's going to start beeping.
We'll do questions at the end, that way we can get through all the stuff.
Okay, guys, so
Ms. Schroeder, it's on you to break it, okay?
So
Say one.
this is how I would explain it to a kid in the hospital who's about to get an IV. So first I would ask, do you know what veins are? Yes. Okay, so what do veins do in your body? They pass blood. Exactly. So what we want to do is first we're going to tie this around the doll's arm, and we're going to help to give this arm a hug to help the veins to wake up. So you can tie that around. And that's going to help the nurses to find the best spot to gently rest this soft, skinny straw.
Ms. Schroeder, pull my strip.
Then we're going
Lock my
to
door.
need to clean the skin. So the skin is nice and clean. Can you just wipe down the arm right there? So it's like alcohol. Have you guys ever had seen alcohol pads?
Yes.
Yeah. So that's like this, but in the hospital. So we're just gonna clean.
Sounds
So
like a
sometimes we use a special light. It's called a transilluminator. And it's a light that we put on your skin that helps us see your veins through your skin. Because it's not always easy to see or feel the veins. Especially, sometimes a lot of the reason why children come into the hospital is because they're dehydrated. So that means they haven't been able to drink. They've either some reasons could be they have mouth sores and they're not wanting to drink. They have a sore throat and they're not wanting to drink. It could be that they have a stomach virus and they're having vomiting or diarrhea, or it could be that they have a fever, and sometimes when you have a fever, you lose fluids from your body quickly. So there's a lot of reasons you can get dehydrated, and that's a most common reason why someone might need an IV.
So Laura's going to demonstrate how an IV goes in, so you guys have an idea of what that process is like. Can you please watch her?
So inside it, so this is a needle inside a really tiny soft straw. So what the doctors and nurses are going to do is they're going to find the best spot. You're going to feel poke for a second, and then once, how do you get this sensory tract?
So this takes 2 people in a child, okay? We usually have 2 people. Once you get it into the vein, you're gonna see the blood come back in this line, okay? Then we pull the needle out, and this is a safety feature, so the needle is now locked inside of here. You can't get cut, you can't get touched by it. And that's to protect us from getting stuck with someone's needle, okay?
So the only thing now that's in your arm is this soft straw that's going to gently rest on one of the veins so that your fluids, your medicine can go through here. So while a lot of kids are afraid of the needle's only really there for a second, and then once the nurses find the best spot, the needle comes out, and the only thing that stays in is this soft straw.
Isn't it kind of like plastic? Because I had an IV like 2 weeks ago.
Yep. And you guys can all touch it. And then the last thing we have up here is these gowns.
So in the video we showed you, a lot of times when kids come in and we don't know what they have yet, they could be contagious, and they could be contagious to the staff or the other children that we're taking care of. Well, we're gonna let somebody else try the gown.
I never think of like putting like designs on these to make the kids feel like
It's my bad.
So the ones that we give the kids to wear if they're traveling in the hospital do have like a Mickey Mouse design on
Wait, it's
them.
not.
But
it's not
again,
snappy.
it's a cost issue. And the hospital, we work in a hospital that doesn't just take care of children. So imagine the adult
Those are the
patients
fun ones.
probably wouldn't want to look at a
Can
nurse
you guys
wearing
pass
Mickey
those
Mouse
few
on
other
them.
things down?
So
Not that. I don't know what
we
that
gotta
is.
share
Yeah, that and
our
those syringes.
supplies with other adult patients.
Dr. Gilman, paging Dr. Gilman.
How may I help you?
Just a few more quick things while we still have some time.
So after the IV goes in, we usually have to protect that area so the children don't knock it out. So this is an example of a board. So let's say you have an IV in your hand. We would take your fingers and we would wrap this around the other way. And then this would just help so that you're not moving it around as much so that it doesn't get knocked out, because it can fall out really easy. As you saw, that straw is only about this long. So if it's in right here and you're bending your wrist like this, it's going to bend and it's going to eventually fall out, okay? So if we can keep that in so you don't have to get another needle, that's what we want to do for you guys. So that
Do they have that straw?
Yeah, Laura, who's got the IV, the springy IV straw?
Right here. Thank you. Okay, so like we said, this is gently resting, like Krista was saying, and we want to keep this in.
Whoa, is that a real needle?
No, this is the
took the
needle
needle
in
out.
the needle, yeah.
That's called an IV catheter or cannula. So when the needle's gone and all that's left is a flimsy straw.
So I also let the kids know, that we don't want to do anything that's going to hurt them. We only want to help them. So say there was medicine in here, instead of every time having to get a needle, now the medicine can just go through the straw. That's already gently resting in their arm.
So we like to tell them that we're giving them a drink, okay? So like I said, the most common reason is That's a cat.
I don't do this.
Sorry, this is my job. So, this is a flush, and this is that saline solution that one of your classmates was talking about earlier. So basically, this is salt water. And once this is in your hand, oops, I didn't mean to squirt you. That made it all the way to you. But once this is in your hand, the fluids could go in through that straw right into your veins.
So this would be completely under your skin up until this point, and then this would be on the outside, this blue part, and this would be taped down to your skin so it stays in. So then when you squirt fluid in, this would be in your vein.
So another thing that I'll do with the kids is we'll do medical play. So we'll take these, we'll get rid of all the solution in it, and we'll put paint in it, and then we can do syringe painting. So we'll paint with these in the room, which is fun. Yeah, it's cool.
So actually that brings up a really important concept, which is called medical play. So you don't necessarily have to have real medical equipment to familiarize a kid with it, right? So you can have a pencil and say this is a syringe, right? And this is when you put a syringe in, it's like this. So just familiarizing a kid with, with that they're going to be approached and something's going to happen to them. You don't need a real medical equipment. Sometimes just playing, kind of like playing doctor, that kind of makes everything a lot less scary for kids.
So sometimes if you're coming in for a surgery or something that's planned, that's something that can be done ahead of time, where they can take you in, they can show you where you're going to be staying, they can show you some of the stuff they're going to use and help familiarize you with that. However, a lot of times it happens unexpectedly, where you have to go to the emergency room, or you go to your doctor's office and they send you to the hospital, and we don't always have the time to do that play ahead of time.
And then I realized I should have brought an IV bag, which I could have easily brought, but I forgot to grab it. So an IV bag is like a plastic bag full of water, right? Which is basically contains the same kind of stuff that's in here, just salt water. It might have drugs in it as well. That would hook up to just a long piece of tubing that would then also, what did I say? Drugs, medicines, medications. That would hook up to a long piece of tubing that would then, again, get connected to this and then go into your vein.
And then one other thing that I brought along, so remember when I was talking about this one and how we like that number to stay 92 or higher? So if that number is not high enough, you may need some oxygen. And there's a couple of ways you can get oxygen. This is a nasal cannula, okay? So this end would be connected to either the wall or a tank that supplies oxygen. And then these little prongs go in your nose and wrap around your ear.
Oh, I've seen that.
Oh, yeah.
And it gives you oxygen.
Yeah.
So there is also a mask way, but as you can imagine, a mask covering your whole face is kind of even scarier than this. Although kids think this is really scary, it's really not very uncomfortable. Sometimes we put, on the little kids, we put a little piece of tape on each side to help hold it down because they won't keep it around their ears. And their ears are a lot more flimsy. So if a baby, their cartilage in their ears is not very firm yet, so you can't just wrap it around their ears. So that's a way to give them oxygen if they come in and they're having a little trouble breathing. Yes?
So with the masks, you don't reuse those, do you? Once you're done with them with the kids?
None of this medical equipment gets reused except for we clean off like this finger thing, the stethoscope,
These wires might get
the wires, and the blood pressure cuff. All the rest of this we get trashed.
So this is kind of how the wires would go on, right? Did I get it right?
Yes.
But they'd be on the skin, right? They have to contact the skin in order to pick up the electrical activity. And then on these ones, oh yes, they're buttons. So these can get thrown out, and a lot of times these wires will be reused. So again, like the process of just putting these stickers on someone and not knowing what these are going to do, like are they going to electrocute me? And then attaching this, because you're coming at somebody with this like electrode, and you may not know that you're not going to feel anything because it's just picking up your natural electrical activity. It's not doing anything to you. And it doesn't really
So one way I explain these wires to the kids is I'll say, okay, so for doctors and nurses, they're gonna put some cool stickers on your body to listen to how you're breathing and how your heart's beating, and I'll ask, have they ever played video games? So you're playing a video game, right? You press the X button and sends messages through the wires and up to the TV screen. Well, these stickers are listening to what's going on in your body, sending messages through the wires and up to that screen with the little squiggly lines. Have you guys seen that? Yeah. So to explain like that, so that's something that they are a little bit more familiar with and that they understand more.